But today I want to talk about something that is rarely talked about, and it's a young mother named Grace died last week by suicide after spending more than a year trying to be reunited with her infant son, who had been removed into care shortly after death. After the birth of the child. Her death raises a broader question about the issue that receives very little public attention. International research has found that mothers whose children are taken into care face significantly elevated risks of self-harm and suicide. A Canadian study published in the Canadian Journal of Psychiatry found that they were almost 3 times more likely to attempt suicide and more than 4 times more likely to die by suicide. Similar concerns were also documented by Professor Karen Broadhurst and colleagues in the UK and Wales. So I'm going to ask a couple of things today, and do you know what? I actually think you might be able to commit to this, Ms. Duggan. So does Tusla collect the data on the deaths, including the deaths by suicide of parents whose children are in care or subject to care proceedings? If not, how can Tusla assess the impact of child removal or parent wellbeing and mortality? Has Tusla ever commissioned, funded or requested an independent research into suicide, self-harm or serious mental health outcomes among parents whose children have been removed into state care? And in light of Grace's death, and I know her mum is actually in hospice care watching this interaction today, and in light of her death, and the international evidence, will Tusla commit here and now, today, to carry out an independent national study into the mental health and mortality outcomes of parents whose children are separated from their children through the care system? And I know we're all talking about the life of the child.
Ensure you don't raise any individual or person.
No, right, and I know we're all talking about the life of the child here today, but we also, every child there has a parent, has a mother and a father. And let's never forget them. And as a foster parent, to me, they were the most important individual in that child's life. It doesn't matter what that parent did to that child and how that parent brought that child. There's unconditional love between that child and that parent that I, as a foster parent, would never take away. So I know that there are a number of children taken away at birth, and I'm just going to ask you, would you commit to having an independent national study into the mental health and mortality outcomes of parents whose children are separated from their children through the care system? Is that something you would commit to today, Ms. Duggan?
I think I'm going to be, first of all, obviously, because if there is anybody watching, I do absolutely pass on my condolences for the passing of that person, and I think it's, you know, very tragic when any person dies, but particularly in the circumstances that you've outlined. So I think that's the first thing to say that is very important. And obviously one of the focuses that we've tried to do for the last number of years is to increase our supports to birth parents in terms of the work we do with birth parents, the support that we give to birth parents, both from a care perspective, from a legal perspective, from, you know, all of that. And that is something that we are committed to doing. When we're talking about something like the independent mental health outcomes of children taken into care, it's something certainly, and what I will commit to do, Senator, is to take that away, because that would be something that would have to be looked at in the context of our parent department. It would have to be looked at in the context of the HSE or the suicide, you know, prevention, because they certainly would have the expertise in that area. In terms of when we are referencing mental health outcomes, that certainly wouldn't be an expertise that we would have. But I certainly can commit to bringing that representation back to our parent department and to look with the HSC in terms of the fact that that identified need was there. My colleague had just talked about the study that's underway, the long-term study in terms of outcomes for children in care. Many of those young people do go on to be parents themselves. Unfortunately, many of them, their children end up back in the care system. So there may be something we can look at within that already, I suppose, commissioned piece of research. But I'll certainly take it away to look at it.
Thank you.
Thank you for watching. Please like and share.